Welcome to another episode from the Veterinary Research Channel. Today, we're diving deep into a crucial topic affecting both veterinary professionals and pet-loving families: access to community care for small animals. This discussion is based on the 2024 American Animal Hospital Association (AAHA) Community Care Guidelines for Small Animal Practice. Our journey begins by understanding that veterinary small animal practice cherishes the bond between humans and animals, acknowledging the vital role pets hold in families. Yet, a significant number of pet owners face barriers in accessing veterinary care, leading to emotional distress, unmet health needs for pets, and even the heartbreaking surrenders, rehoming, or euthanasia of beloved animals. This inability to provide care can inflict moral distress on veterinary teams, contributing to burnout and turnover. Many veterinarians are eager to expand access to care, but need guidance. These guidelines offer strategies for busy veterinary practitioners to increase access to care within their practice and community by optimizing collaborative networks. While not exhaustive, they provide a starting point for private practices to explore and implement solutions for their community and practice. What is community care? Community care is a creative approach to healthcare access, mobilizing resources within a community. It centers around four core principles: recognizing the urgency of access to care, fostering collaboration within community networks, providing family-centered healthcare, and redefining the gold standard of care. This model seeks to resolve the dilemma faced by private practices, providing care versus turning a patient away. The spectrum of care and access to care. Spectrum of care, SOC, involves providing a continuum of acceptable care, considering evidence-based medicine while remaining responsive to client expectations and financial limitations. It utilizes available diagnostics and treatments to improve access to care. Contextualized care, a key aspect of SOC, considers the family's circumstances in decision-making. For instance, a dog with parvovirus might receive outpatient treatment if hospitalization costs are prohibitive. SOC also recognizes when early referral or advanced diagnostics can lead to better clinical and financial outcomes. Access to care means pet caregivers have the economic, physical, social, mental, and emotional resources to secure and benefit from veterinary services, optimizing the health and welfare of their animals. It necessitates affordable and consistently available services, irrespective of race, socioeconomic status, location, culture, language, gender, and ability. Addressing these challenges requires community-based solutions that support veterinary professionals and reduce moral distress. The challenge defined: understanding the need. The veterinary profession has historically served the economically and socially privileged, leaving marginalized populations to face significant barriers in accessing veterinary care. A community care model aims to make access to care a priority for all. Over the last decade, equitable access to veterinary care has become a prominent issue. With a majority of U.S. households including pets as family members, the profession has an obligation to make services accessible to all who need them. However, many families find veterinary care inaccessible due to the existing model of paying out of pocket at the time of service. Although pet insurance and alternative payment strategies are emerging, they remain out of reach for many. Economic factors classify a growing number of Americans as financially fragile, making it difficult to access routine and urgent veterinary care. Adding to the problem, some in the veterinary profession believe that those without the means should not keep pets. While a large percentage of veterinarians agree that all pets deserve some level of veterinary care and that the inability to obtain veterinary care negatively impacts families' mental health, a significant percentage disagree that everyone should be able to keep a pet regardless of their circumstances. These attitudes can hinder the exploration of access to care solutions. Besides financial constraints, other barriers include the location of clinics, language, and recognition of the pet's needs. Inequities in access to veterinary care mirror broader societal challenges, including structural racism and oppression of Black, Indigenous, and people of color (BIPOC) populations, immigrants, refugees, and LGBTQIA1 individuals. Health equity ensures everyone has a fair opportunity to be as healthy as possible, regardless of their background. The veterinary industry can reduce barriers to care by implementing inclusive policies and procedures. Diversity, equity, inclusion, and belonging must be viewed within the context of access to veterinary care. Moral distress in the veterinary profession. The dominant practice model, requiring out-of-pocket payments, limits access to those with financial resources, leaving practitioners with few options for clients who cannot pay. This creates a conflict with the veterinary oath and the desire to help animals, leading to moral distress. Surveys indicate that a significant percentage of veterinarians experience moderate to severe distress due to obstacles preventing them from providing appropriate care. Traditional approaches often burden clients and practitioners, failing to address the need for systemic change. Operating within a community care model can benefit clients, veterinary teams, and the profession by increasing job satisfaction and improving retention. Acknowledging and acting upon the responsibility to ensure equitable access to veterinary care is a crucial step forward, as everyone deserves to experience the human-animal bond. Family-centered practice, a new framework. Family-centered veterinary practice recognizes that pet caregivers come from all socioeconomic backgrounds and promotes health equity by considering the caregiver's financial situation and other realities. It redefines the gold standard as high-quality, system-level care that ensures services regardless of socioeconomic status and other barriers, considering the contextual needs of each patient and family. This approach views the family as an interconnected system, providing comprehensive, coordinated care. Family-centered veterinary practice embraces a One Health approach, recognizing the interconnectedness of humans, animals, and their shared environment. Traditional veterinary care often focuses on disease management in isolation from the family's needs. Taking back the gold standard. The term gold standard often describes the highest quality, most expensive approach, but this doesn't serve all families and implies other options are substandard. Spectrum of Care offers strategies for patient management based on medical and family priorities, scientific evidence, and practitioner experience, expanding the range of diagnostic and treatment options. Redefining the gold standard to encompass SOC within a family-centered practice model can help increase access to care. This broader definition includes a range of diagnostic and treatment options, accessibility, consideration of the family's contextual needs, high quality and safety of care, high likelihood of positive outcomes, and evidence-based medicine. Family-centered practice in action. Implementation. A practice culture that prioritizes keeping pets with their families by providing equitable access to care is the foundation of family-centered practice. Key elements include clearly articulating the practice's goal of keeping pets with families whenever possible. Engaging in training and discussions to foster a shared sense of purpose among team members. Educating the team on barriers to access to care and the principles of SOC. Developing written policies and SOC guidelines for common conditions. Addressing harmful beliefs and providing diversity, equity, inclusion, and belonging resources. Holding regular discussions to identify and overcome care barriers. Providing multiple types of payment options. Cost is a major barrier to veterinary care. Offering a toolbox of payment options, such as payment plans, third-party providers, and pet insurance, can help families overcome this barrier. Embracing a spectrum of care, SOC, approach. SOC is a family-centered, experience-based approach that aims to achieve the best possible outcomes while respecting client limitations. Key principles include contextualized care, considering the pet's and family's needs, goals, circumstances, and potential challenges. Experience-based and evidence-based, using clinical experience and judgment alongside evidence-based practice. Tiered, deferring more expensive or invasive procedures if appropriate. Dynamic, maintaining a flexible care plan that can be adjusted as needed. Discussing treatment options with clients. Client communication is vital, considering the family's overall quality of life. Ask about the client's goals and understand their financial situation. Explain the spectrum of options, being clear about costs and discussing payment options. Discuss any other barriers to care and be empathetic and understanding. Listen actively and without judgment. Optimizing the role of veterinary technicians. Well-trained technicians can perform many functions independently, extending a practice's veterinary services, increasing job satisfaction, and reducing turnover. They can address barriers like language, disability, clinic capacity, and cost. Examples include technician-only appointments, patient intake, client education, and implementing protocols for common conditions. Offering telehealth options. Telehealth can overcome logistical and financial barriers, requiring awareness of state and local regulations. It can address mobility issues, time constraints, and promote continuity of care. Training multiple staff members for financial conversations. This improves customer experience, reduces stigma, increases client satisfaction, improves financial outcomes, and reduces stress. Offering multilingual support. Practices should offer communication support in clients' primary languages by hiring bilingual staff, seeking community language services, using translation services, and creating multilingual resources. Real-world collaboration, finding common ground. Equitable access to veterinary care requires an interdisciplinary and collaborative approach involving private practices, government and nonprofit organizations, and pet caregivers. Collaboration in veterinary medicine involves three circles: collaboration among team members within the practice, collaboration with other veterinary practices in the community, collaboration with allied health providers, suppliers, and other community service providers. Benefits of collaboration include sharing knowledge and expertise, optimizing available resources, supporting continuity of care, inspiring creative problem-solving, promoting business growth. Community care networks in action, connecting solutions. A community care network relies on diverse service providers who collectively eliminate gaps in care due to health inequities. It enrolls affiliates of private practices in case management for both people and pets, including nonprofit clinics, shelters, rescue groups, behavioral health providers, and housing agencies. Identify community-based challenges clients face. Work from an asset-based framework, valuing existing capacities and connections. Grow partnerships across the community care network, including financial, direct veterinary care, and allied services. Engage with other veterinary practitioners. Keep a list of community resources. Leverage practices with different business models. Get involved with local animal welfare organizations. Look for veterinary services offered through low-cost clinics, spay/neuter clinics, shelters, and rescue networks. Conscientious referral is crucial, mirroring the process used for specialty-level care. When engaging with animal welfare agencies, ascertain their resources, capabilities, market, and scope of services. Engage with allied care providers. Veterinary social work and community social workers provide essential allied care. Search community resource databases and N11 code lines for available services. Engage with financial support partners. When client funds are insufficient, partners activate the community care network, offering help to both practices and pet caregivers. Formalize case triage across the community care network. Use health advocates or case managers to help manage information, connections, and resources, enabling access. How to begin connecting a community care network. Survey the clinic's veterinary team about cases and concerns they think the clinic may not be addressing. Gather from the team what they want to do more of and how they see their role in addressing these issues. Find out about relationships and partnerships in the community that team members already nurture. Examine your own network. Empower a team member to carry this work forward, providing specialized training. Create a quick reference of community resources. Adopting a family-centered approach allows veterinary practitioners to find solutions that work for more pet caregivers, alleviating moral distress, promoting job satisfaction, and reconnecting with the veterinarian's oath. A community care network within a family-centered practice framework ensures that no one is alone in facing access to care challenges. By building partnerships spanning private practice, nonprofit practice, and government spheres, veterinary teams support each other in this important and life-saving work. Thank you for listening to the Veterinary Research Channel. A link for the referenced paper is in the video description. Remember to test your knowledge by answering the questions in the description, and as always, keep those minds inspired, hearts light, and tails wagging.